Welcome to my good friend, Professor Mousa Khoursheed. Professor Khourseed is a professor at Kuwait University. He works in the Department of Surgery as a consultant, Mubarak Al-Kabir, and heads the surgery department at Taiba Hospital. Mousa founded the Kuwait Surgical Society and has run the national meeting of the Kuwaiti Surgical Organization for the last approximately 18 years. An outstanding meeting. I always look forward to going there and participating and speaking at Professor Khoursheed's meeting. And in fact, he was very prescient because the first meeting canceled this year was his, which was meant to have been in early March. And that was the very first notice I got of a canceled meeting was his. So Mousa, you're way ahead of your time before everyone else caught on. Welcome to the American College of Surgeons, ACS COVID-19 from the front lines.
Thank you, Steve, for having me on board. It's my honor, and I would love to share our experience. Unfortunately, we had to cancel the meeting. You always come and help us in Kuwait, and unfortunate, but we have to take actions at that time.
You were correct in taking the action when you did a few weeks prior to that meeting, when, except for Italy, the rest of the world was still really largely unaffected. So congratulations for your wisdom once again. One question that I've got to start off is seemingly in Kuwait and many of the neighboring countries too, in Saudi and Bahrain, Oman, and the like, it seems that the incidence is low compared to Europe and other places. And I'm wondering if you could expand upon why that might be in terms of the timing of government actions, the type of government actions that may have occurred accounting for this seemingly regional low incidence.
Yeah, well, what happened in Kuwait is that the first cases of COVID-19 came from people who were traveling to Iran. They go for ritual reasons, and then there was a time when there was a sudden outbreak in Iran. So all those travelers from Iran brought the disease at the beginning to Kuwait. Then it's, Kuwait took immediate action. They started to collaborate with the WHO and people from China, from all over the world. They made teams, including Ministry of Health, Ministry of Trade, Interior, etc. And then they had to quarantine people. So it was something which was shocking for Kuwait, but they have taken immediate actions. So we were able to contain the disease from the beginning, and because of the government regulation, strict regulation in terms of quarantining people and starting a curfew, that has limited the amount of patients we had in Kuwait. So far, we had until today 1,400 patients, and we were in the range of 60, 70. So it was then climbing to 160, 150, and then we are down the curve now. So we are probably at the curve where it's flattening, and then instead of having the curve that peaks up, we were able to control that curve, and then it's a flattening now, and it's coming down somehow. We had 3 deaths. We had we have so far 30 patients in the ICU. So in a population which is 4.5 million, we were able to contain the disease quite well in Kuwait.
Well, again, that was evident that your meeting for the very beginning of March was canceled in February, which is ahead of the curve, as it were, for many meetings that didn't realize until places got hit later on in March. And of course, international travel was stopped. Is that still the case? There's no international travel?
Yeah, the airport is closed, and and all the vacations has been canceled. No one is working. We have a total curfew starting from 5 until 6 o'clock in the morning, 5 p.m. until 6 a.m. And people are not working. They are not allowed to go to work. All government, some of the private companies, yes. All the meetings have been canceled. Every ministry asked, people to cancel their meetings and so on. So, including Ministry of Health. So that's why we were from the beginning. We have canceled. It was better to cancel our meeting. We've been working on this for the past 1 year, and then Steven Stein was supposed to come earlier, so he was the first one I contacted, and I told him, Stein, listen, we can't have this meeting. I'm unfortunate. So he could not imagine the impact of this. But if you see what is happening today, that all the meetings all over the world have been canceled. So coming back to your question, it was the strict act and quick action from the government that probably contributed to the reduction in the number of the pandemic and outbreak of corona.
So now let's move a little bit to the surgical level from the governmental level. What's happened there for elective surgery practice, number one, and for your workforce, for other consultant surgeons working with you in digestive surgery?
Yeah, so in terms of when we come to conventional surgery, all elective being canceled, including hernias, thyroids, breast, colorectal benign diseases, and so on. We only do emergency surgeries, and that includes, appendicitis, GI surgery, abscesses, and so on, acute abdomen or trauma. That is the other thing. When we come to laparoscopy, also we are trying our best to reduce intervention by laparoscopy unless it's for the benefit of the patient. So we are weighing the risk versus the benefits. We've been looking at guidelines from different societies, including surgical societies, bariatric surgery societies, and so on. And we've been following these guidelines and regulations. So we are taking action in terms of using the PPEs. However, we are not like, some of those things are starting to diminish now in Kuwait, although we had a big stock of this. But people who are in contact with those patients cared for with coronavirus, they have got all the protection, personal protection equipment. Now, another issue, which is laparoscopy, we are trying our level best to avoid, to protect personnel in the theater from contacting the disease, because, as you know, many patients, they are asymptomatic and they come to us with, for instance, acute cholecystitis, diverticulitis, or appendicitis. So we do them with a laparoscope. We followed what Abe Fingerhut he published something at the Annals of Surgery, Luigi Boni, and someone from China. And now, when we evacuate the gas, if I may show you this, we follow this technique. So we have, this is number 3 millimeter endotracheal tube that you use for pediatric patients. So this is the connecting tube that you can apply on the filter. And we use this filter, we take IV line, we cut it, we connect it at the end of the procedure with the port. And then we evacuate the air through this filter. And this filter is supposed to catch less than 50 millimicrons of particles. So this is a way of protecting our staff in the theater. We are minimizing the number of staff. If we can treat acute appendicitis conservative with antibiotics, we do that. If we can treat acute cholecystitis in the same way, we do that. So we are taking utmost precautions. Now, it is also the ministry which is keeping an eye on the hospital's practice. So they make sure that you are abiding to the guidelines and you are not doing elective cases. If you do that, they could close the department of the hospital. So it's something from our side, from the government, making sure that we run things according to guidelines of safety.
Well, I'm glad that you mentioned our mutual dear friend Abe Fingerhut. I've interviewed him for this program as well about his paper, and I know he'll be happy to see your interview and that you actually showed the smoke evacuation filter device that he described in his Annals of Surgery paper. Question for you about workforce. Are all of the surgeons now working, or are you divided in groups to limit physical contact and overlap and give people rests? Yeah, we are trying our level best to do that. So we have different teams when you come to government hospitals, but the workload has diminished so much because of the careful. We don't see so much of trauma. They deal only with emergencies. So most of the time, the workload is not so heavy. Personally, I work in a hospital where we are 3 surgeons. One of them is stuck in Egypt because, airports are closed. The other one got unfortunate pneumonia, not related to Corona, but I'm working alone in the hospital, in this hospital, but it's fine. I mean, I have registrars and some junior residents who help in this. So they are taking their own calls and we divide our work accordingly. So no, not everyone will be exhausted. Are surgeons in the country retraining in some of the bigger hospitals to help out in intensive care, surgeons or to help out in other areas? Surgeons who are not doing elective surgery, for example, plastic surgeons or ear, nose, and throat, whoever, colorectal, people who are not doing elective surgery, are they retraining to do other things in hospitals? Yeah, that's a good question, Steve. We have a task force now that controls this whole pandemic in Kuwait. So what they do, they train people who are not trained in handling coronavirus patients. And they train them over a period of a week or a couple of weeks. And then, because the problem is that quarantining people and people who are found to be positive, Kuwait is small. We don't have many intensive care units. And that's why we have to be very, very careful. And also, many of the nurses and doctors, we have doctors who have been infected. At least we have 25 doctors and many nurses who got infected by the virus because of their exposure in spite of the PPEs that have been used. So the ministry is asking now for people who would volunteer in helping nurses, doctors, and they train them, and accordingly they expose them to those patients, including also private hospitals. So they are asking, they're expecting something which may become bigger, so they need to be ready before something bad happens in the country. And then very last question for you, how frequently is testing being done? Are all patients coming to hospital being tested? Are all patients for surgery being tested? Are patients only with symptoms being tested?
Yeah,
What,
as many patients can be asymptomatic, and incubation period can be up to 14 days. So anyone who comes from outside Kuwait, we have almost 50,000 Kuwaiti people waiting to come back to Kuwait. So anyone who comes back to Kuwait will be quarantined and tested for the disease. So they do the rapid test, and sometimes they do the PCR. And then they are quarantined for 2 weeks, and then they are tested again. And then people who have symptoms also, suspecting the virus being infected, also are tested. So at one stage, we were the highest country in the world doing the rapid test in Kuwait here. At the beginning, they've done a lot. Until now, we're doing a lot to look for the disease and screen people.
asymptomatic patients presenting for emergency surgery, are they being screened?
No, we don't do that. So, I mean, we still have the risk. I mean, as a health worker, we are exposed because, I mean, this will be a huge cost if you are testing any patient who walks in the hospital. So we're not doing that. Whether it's in the government hospital, in the private hospitals also, we have a problem that we don't have the rapid test. It's not available. So whenever we suspect a patient with the disease, we refer them to the government hospital.
Well, I'm pleased that you're healthy and well, and it's good to see you, even if only on video at the moment. I look forward to returning to Kuwait when all of this problem is hopefully behind us. In the meantime, I wish you and your family sustained health and sustained safety through the pandemic. I thank you for your time and expertise this morning.
Thank you very much, Steve, and stay safe.